I would like to introduce Dr. Dave Dornfeld. He is with the Family Wellness Center in New Jersey. We're going to be talking about hyperbaric therapies, how safe detoxification and hyperbaric therapies can help your children improve. Hi, Dr. Dornfeld. Thanks for being here.
Hi, how are you today? Thank you for inviting me.
Doing great. I'm so excited to talk with you. I think that this is a topic that many people get confused on. They maybe don't understand what hyperbarics are. But before we get started with that, I know that you after your name it says D.O., where other physicians usually have the letters M.D. after their name. Can you tell me what the difference between a medical doctor is and what the letters D.O. stand for?
Well, a DO is a doctor of osteopathic medicine, so it's the same training that a MD, a allopathic medical doctor, obtains. However, in a DO profession, it's a little more holistically minded. It's a little more systems-based approach. So we treat the person who has a disease rather than the disease the person has. Most of the DOs specialize in family practice as well as internal medicine, but there are many DOs who do orthopedic surgery or neurosurgery or endocrinology. So, you're not limited as a DO, but I use, in easy terms for people to understand it, it's like a chiropractor and an MD combined. So I do a lot of musculoskeletal work and try and take care of the human frame that supports all the systems of the body. And when we're brought up as an osteopathic physician, we're taught to try to think about the entire person and how they can improve with the conditions around them. So I think it's a better of both worlds to have a DO who has a little bit greater knowledge in trying to put things together rather than a specialty-oriented doc. Most of the MDs, they can be some primary care docs who do internal medicine, but sometimes they end up as a cardiologist or an internal medicine doc or a nephrologist, and they don't really do the whole generalized care. So if you want to do pediatrics, if you want to do family practice or internal medicine, it's really ideal to be an osteopath because you're trained in the entire body's approach, and you should be well-versed in what goes on throughout. But again, all DOs can be any specialty possible, not limited in surgery, not limited with prescriptions, but do the same things that MDs do, but a little bit more because we have a little more understanding of the spine and musculoskeletal conditions.
That's wonderful. Now, obviously our topic and our summit's on autism, and there's a lot of people talking about autism today. Why do you feel there is this huge increase in rates of autism in this country?
Well, I really think the environment plays a huge role. They always tell us, I've gone to so many conferences for so many years already, and we always go and we learn new things going to all these great conferences that are out there, but the basic understanding is, well, the genes load the gun, but the environment pulls the trigger, and the environment is always changing. It's always to the negative side for healthcare, and it's so important to take care of the person and balance them out. And a lot of times these kids do have some of the genetic predispositions that allow them not to detoxify well. The statistics about the MTHFR gene, everybody talks about that all the time. 35 to 40 to even 50% of the people in the world, not just autistic families, have an MTHFR gene abnormality. And this gene helps you, or actually hinders your ability to detoxify and get rid of some of the environmental pollutants. This world around us is full of GMOs and pesticides, and we'll talk about that, I'm sure. But these are huge problems. There's a lot of problems with food allergies. You've seen so many times autistic kids do so much better with gluten-free diets or casein-free diets or GAPS diet or oxalate-free diets. And these different diets are so important to follow because it knocks inflammation down. Every disease is based on inflammation. And autism is one of those diseases that when you have an inflamed person, they can't clear the toxins well. They can't get rid of some of the problems. They can't oxygenate the tissues. And that's where some of the therapies that I do help so drastically or dramatically in reversing some of the autistic problems.
Now, I know in past conferences that you presented at that you and others felt that Tickborne Diseases contributed to autism. Why is that, and how do we even determine a child has Lyme disease to begin with?
Well, that's a great question. I went to a conference on Lyme-induced autism. I never really thought that was such an issue, but there actually is a great number of kids who have underlying Lyme disease, and when you treat their Lyme disease, their autistic symptoms go away. Both of those are big masqueraders of disease. In Lyme disease, as well as in autism, mercury is one of the most important toxins affecting recovery. There's a high body burden of molds, parasites, and viruses in both of these diseases. And when we get rid of some of these problems, the kids get better. I went to I think it was an Autism 1 conference I went to years ago. I was sitting on the panel, and there was a conference or a speaker from France who was talking about a great study showing that in France, when they give kids antibiotics, all of a sudden a lot of these kids improve their autism. And that was earlier in the day, and one of the parents put their hand up in the air and says, "Could you please explain why you think that giving an antibiotic reversed autism?" And I said, they probably had underlying Lyme disease. And by treating the Lyme disease, their autism got better. Well, I had about 40 hands that went up after that, and all they wanted to talk about was Lyme disease and how it plays a role. And it's so difficult to diagnose Lyme disease because the lab tests are terrible. Doctors in general don't think about tick-borne disease. And when I say Lyme disease, I don't mean just Lyme. I mean the whole gamut of Babesia and Bartonella and Anaplasma and all these other different agents that are in the stomachs of these ticks, which can lead to problems with development of these kids. And it causes a lot of brain inflammation in people who don't have autism. So when you treat a Lyme patient who has brain fog and has joint pains and has fatigue, they get a lot better. Well, if you have a child who can't speak and who's got joint pain or doesn't process things well, and you improve their cognitive abilities by giving them antibiotic, well, lo and behold, you're actually killing some of the underlying Lyme. And the lab tests for it are so hard. So it is a very difficult situation when we have Lyme-induced autism. So you also have to think about tick-borne diseases. And I'm speaking at a conference in Pennsylvania on Lyme and tick-borne diseases, as well as, again, in Autism 1. So I'm going to touch this base quite a bit this year, that it's so terribly important to remember how bad these ticks are and how to prevent them. And don't use DEET, please. DEET is one of those bad neurotoxins. You want to use a natural tick spray. And also remember that Lyme disease can be spread by mosquitoes. 22% of the mosquitoes in the United States can carry Lyme disease. And spiders and lice do as well. So you have to really be careful about insects.
And is it just, I know, if I live on the West Coast, and so we don't really think about Lyme disease here. I think more people on the East Coast probably think about it, but we still have to be worried about it as well, it looks like, at least with the mosquitoes and other insects. But
every state has Lyme disease. Every state in the country has it. 22% of the mosquitoes, like I said, in the United States have it. 12% of the mosquitoes in Europe can carry Lyme disease, and it's not just mosquitoes. It's, like I said, spiders and mice, lice. And everybody thinks, well, I don't have deer in my backyard, so I can't have a problem. Well, that's not the case here, because the Lyme tick decides to hop on the back of a bird or a mouse. So you figure any place a bird can fly or a mouse can crawl, we could end up with getting tick-borne disease. Also, unfortunately, it has been proven that tick-borne disease can be sexually transmissible from the mother, from the father to the mother, as well as from the mother to the child. It can be found in breast milk. There's been babies born with Babesia. They didn't get it in the nursery. They ended up with a parasitic infection from the mother who had Babesia during pregnancy. So it's very important to be careful, especially during pregnancy, to use natural tick sprays, citronella-based, not DEET-based. DEET is a neurotoxin. I hate the idea they keep telling pregnant ladies to put DEET on them. Because you don't want to do that. You don't want to put any more neurotoxins on kids or developing neonates. So you want to think about what are you doing during your entire pregnancy, and you want to try to avoid tick-borne diseases. It's in every state of the country, and they don't understand how to test for it because the testing is not very accurate. They need to get better testing, and hopefully we'll be able to knock it out. And they also say, well, you have to have a rash. You know, the CDC doesn't really understand it as well. Only 20 to 40% of the patients actually have a rash. And again, the lab test is so poor. So you have to really have a high index of suspicion. You have to see a physician who's well-versed. Now, there's a great group of doctors from a company called ILADS, I-L-A-D-S. That's the International Lyme and Associated Disease Society. And the Lyme-literate medical doctors is what we're called, are pretty well-versed in looking at these topics and trying to go to ilads.org, I believe it is, ilads.org. You can find a Lyme-literate physician in your community who's received serious training in proper ability to help diagnose and treat these kids as well as adults.
Now, you're talking about a lot of times the tests, they're not looking at them right, or the tests aren't accurate. For those listening, what tests should they ask their doctors for then?
Well, everybody's going to do a Lyme Western blot test, and unfortunately it only tests 1 out of 90 species of Lyme, which is crazy. You can enhance it a little bit if you go to these specialty labs like MDL Labs, or what I use is IGenX, IGENIX in California lab. Some insurances actually help out with that. Most of the insurances don't. But IGenX is one of the better labs we have. Stony Brook labs are pretty good. But there are higher quality labs. But you have to have index of suspicion, and you can't just test for Lyme. You have to test for other co-infections, Mycoplasma, Anaplasma, Babesia, Bartonella, multiple species of these guys, Chlamydia. These are all tick-borne related diseases. The mouth of a tick, unfortunately, is a cesspool. So I know we were talking about hyperbarics mostly on this topic, but we get off on a tangent because Lyme disease is so huge of a problem, and most docs know nothing about Lyme disease. So I just wanted to touch base on that a little bit more for you, because Lyme is something that's poorly diagnosed and really difficult to treat. And nobody wants to give kids antibiotics for 3 to 6 to 8 to 12 weeks. But if they have a tick-borne disease within them, they need that. And they have to support the gut, and you have to take care of everything else that we normally do with autistic kids. But this is so important to be well aware of. And if you do have a kid who's potentially for Lyme, you need to find a Lyme literate physician and do other tests, C4As and CD57s and VEGFs and other tests that give you idea about inflammation in the body. Again, the Lyme literate medical docs, we know these tests pretty well.
Well, I think so far just that little bit that you were able to talk about, my goodness, I feel like I learned a lot. I had no clue that 22% of the mosquitoes in the country could carry that. So that, to me, is a huge piece of knowledge for us.
I jokingly tell my patients, if ISIS doesn't kill us, I think the insects will, because we have so many insect-borne diseases out here right now that, between the Zika crap that's going down in the South American area, and the hype from that, and SARS and MERS and all these other different tick-borne, the plague, and all that dengue fever. You got to watch out for insects. They definitely have problems, and they're also affected by the same thing we are. We have all these different pesticides, and we have all these different electromagnetic frequencies that are affecting their life and their resistance, and they're becoming superbugs as well. So we have to really be careful. We have all these pesticides that are now being sprayed on our crops, and the insects are now going to accommodate to them, and they're going to change as well. We have to have stronger pesticides sooner or later, and then that's going to be even more of a problem. So right now we have to deal with what we have.
Now, you talked about, some of the burden of the different toxins that are out there, especially with the chemicals you were talking about. But are there any websites that you recommend to parents to view in order to reduce the toxic burden of environmental pollution that our children, today are being exposed to?
Well, my favorite one is the Environmental Working Group. That's www.ewg, environmentalworkinggroup.com. That is a huge site where you can look for various helpful hints, things like I'm walking across my neighbor's lawn with my sneakers on, or my kids are. Should we take their sneakers off by the front door, or should they put their sneakers next to their bed at nighttime so they can have all the pesticide-coated sneaker, let them breathe that air all night long? Or like you go to the dry cleaner, am I going to take my dry cleaner garment, am I going to take the plastic bag off my dry cleaner garment before I put it in my closet? Or should I trap all the chemicals from my dry cleaning to go into my closet? I mean, these are common sense items. So just thinking about those two items, you would reduce your toxic load of what's going on in your bedroom tremendously. You have to watch for electromagnetic frequencies in your house. You should knock your Wi-Fi down at nighttime. We repair, mostly health-wise, when we have a good sleeping sanctuary. A sleeping sanctuary should be where we're sleeping at nighttime without any influence of negatives around us. So our environment in our bedroom is really important. You don't need to have an LED light alarm clock next to our heads. We don't need to have the cell phone charger next to our head. These things definitely make a problem. So the Environmental Working Group has very good information there. One of my favorite apps we put on people's phones is the Dirty Dozen. So the Dirty Dozen is a great area where you can find out what foods need to be organic and what foods can you get by without being organic. So when you're looking at, that's a great guide. So you know, hey, I can't afford buying everything organic. Do I have to buy avocados organic? No, that's the least pesticide fruit we have. Do I have to buy apples organic? Absolutely. So you want to think about, that tells you what foods are high on the list. And that's a great app to have on your phone, and you can find it also on the Environmental Working Group. I also like another app for your phone called Skin Deep, SKINDEEP. That talks about, are the chemicals I'm putting on my son or my daughter or myself, are they healthy? Because the skin is the largest organ of the body. So if we put those items on our skin, is it good? Should I put Burt's Bees sunblock on myself, for example? That's a very low toxin. Or should I put on another agent, like Neutrogena or Coppertone or something like that? So the Skin Deep site will tell you that Burt's Bees or Kiss My Face is a lot healthier than some of the other ones out there.
Now, you mentioned fruits and vegetables. What are the worst fruits and vegetables to be concerned about, and the ones that must be organic?
So my favorite ones, like I said, if you look at an app or if you look at the Dirty Dozen site, the most important ones to have are apples, nectarines, peaches, strawberries, grapes, celery, spinach, bell peppers, cucumbers, cherry tomatoes, snap peas, white potatoes, hot peppers, domestic blueberries, lettuce, and kale. Those are the ones I always recommend to be organic. And you can't look at the thickness of the skin to determine if it needs to be organic or not, because let's say in the example of lettuce and kale, they grow the same way as cabbage does. But cabbage is a very low pesticide food, and lettuce and kale are very high pesticide food. And that's because the insects don't like cabbage as much, so they need less pesticides. Same thing with like cherry tomatoes. They need to be organic, but whole tomatoes, regular large tomatoes, don't need to be organic because the cherry tomato is a lot sweeter. It requires more pesticide on it because there are more insects that are being attracted to it. So that's how you have to look at it. You also need to also think about another great application is to find out if the item has GMOs in it or not. Genetically modified organisms are things you don't want to have in your food. So if you have a app on your phone called the Non-GMO Shopping Guide, there's a GMO project that's out there. You can look on the website and find that out as well. GMO project. And there'll be like a little butterfly with a check mark next to it. And those foods that have a non-GMO label are a heck of a lot safer because they don't have glyphosate, they don't have Roundup, they don't have inflammatory pesticides within the food like white potatoes and apples, 50% of corn, 94% of the soy, 90% of the corn, and 77% of the papaya can have the DNA of Roundup at least within the plant or on top of the plant that you can't peel off the plant. So you really want to think about, am I eating the right food when I'm having a cow or a chicken that's been fed a genetically modified corn or soy product? So that's why organic industry and grass-fed industry is so much healthier for the outcomes and knocking inflammation down, which again is going to solve a lot of the problems that the kids on the spectrum, as well as the adults with Crohn's disease or arthritis or cancer, have with them. So you want to think about what are we possibly causing with our problems with our family and try to reduce them by giving the right food. Since food should really be medicine, we want to think of it that way rather than food should not be pesticide.
I think that's a great way to think about it. And you talked about, as you're talking about all the environmentals and you're talking about all the toxins, one thing that we're always thinking of in the autism community is heavy metals. They're one of the most problematic things we talk about. Where are those sources coming from to begin with?
Well, we have problems wholeheartedly with heavy metal exposure, and that's one of my desires in life is to try to really work on detoxifying kids safely with heavy metal detoxification methods. Our environment is pretty bad, as I mentioned earlier. We talked about food. We talked about ticks. Well, I really feel that heavy metals are a huge problem we have. And where do they come from? A great question you had. Well, if you think about what are the most important heavy metals we have to be concerned about, we have aluminum. We have aluminum in underarm deodorant. We have aluminum in some of the processed cheeses. We have aluminum in foil and acids. We have it ubiquitous in nature, and there may be some problems with memory loss associated with aluminum. We have problems with cadmium. Cadmium can be found in those light-up batteries that people have on their shoes. It's in the sometimes in the soil. It's in secondhand smoke. It's in the environment wholeheartedly in some of the paints that are being used. You know, I had, if you remember years ago, Shrek, the movie came out, and they had little glasses they gave out at McDonald's that had the various little characters on the glass, and that paint was 100% cadmium. And these kids were coming down with some major problems with that. Excuse me. Arsenic is another major problem. It's found in chicken. It's found in shellfish. It's found in eggs. It's found in almonds. So you want to have organic almonds, organic chicken, organic eggs. You don't want to have arsenic inside of it. Like, arsenic is allowed in the water system. Lead is another huge problem. Look at Flint, Michigan. I mean, they should be doing chelation therapy on these kids in Flint, Michigan, and I don't know why that's not happening yet. It's absolutely absurd. It's a safe way of taking care of the problems and removing the metals out of the system. Lead is in the soil. It's in gas. It's in jetline fuel. So we can't avoid jetline fuel. It's over our head every single day. It's in the soil when they used to have leaded gasoline. Unless your farm was far away from the major highway, there's lead in the soil. To get an organic farm, to prove organic quality, you have to do some major processes in order to prove that there's no lead in your soil. Mercury is the hardest one to get rid of, and that's another major heavy metal. That's found in fish. It's found in dental amalgams. It's found in some of the vaccines. In the past, it's in high fructose corn syrup, which really should be called high fructose GMO corn syrup. Then there's nickel and tin and titanium, and those are in canned goods. You have nickel in cigarette smoke. You have certain vitamins have titanium dioxide wrapped around it. I don't think that's very healthy. There's uranium that's in the soil. So you have all these metals in our world, which are ubiquitous in nature. They're just out there. Yes, they're natural. They come from the earth, so they don't get too excited. But too much arsenic leads to cancer, and too much cadmium leads to cancer. And all these items are really horrendous. So when you look at the Autism Research Institute, when they had responses from parents, I think it was 28,000 parents who questioned what therapy worked for your child, what therapy did not work for your child. The number one answer during that period of time when they had those polls going on was chelation therapy worked between 73 and 75% of the time. Parents said chelation therapy was a huge benefit to my child. So I really like looking at the environment, finding out how they're getting exposed, how much they have in their system, and then how can we get rid of it safely.
I think that's super important, and I wish all doctors were looking at it in the same way, because I feel like often they're overlooking some of the most important things. And how do we test for exposures to these toxins in our kids and in us?
Well, I think the hair analysis is a phenomenal way of determining it. If you look at a blood test, you're not going to get long-term exposure. I live in New Jersey here. 9/11 was very close and near and dear to my heart because it's right out the window from my house. It was the view of the World Trade Center from afar. So when I try to get explanation to patients, I tell them, if you were at 9/11 that day or the next day or the next day, and you were at the rescue site, you would have aluminum and mercury and cadmium and lead and arsenic and probably a bunch of other chemicals in your bloodstream that day, the next day, and the next day, and maybe even the following day. But after that, it wouldn't be found in your blood. It would go into your fat cells. It would go into your brain. It would go into your kidneys and your liver and your adrenals and your other organs and your bone. And it would stay there. And if you had a blood test done, it wouldn't be in your blood test. It would be in your tissues. So that's amazing with these kids in Flint that have still lead levels in their bloodstream. This is acute exposure. This is high toxic levels. in order for them to have it in their bloodstream. But forget about the flint for a second and stay on topic for you. How do you measure exposure when you can't find it in the bloodstream? You look for it in the hair. The hair is a great depot for the last 6 months of exposures to the environment. So I like to do a hair analysis. It's a pretty inexpensive test. I send my hair analysis over to one of the quality labs, and we determine what's going on. And that tells us, number one, on the top of the page, heavy metal exposure. I listed a bunch of the heavy metals before, and it'll give you a great idea as to where you are from, like I said, from cadmium and arsenic and aluminum and antimony. But on the bottom of the page, it gives you an idea of how well you've been giving certain nutrients and supplements to the patient. So when we find out that the person has calcium and magnesium and iron and cobalt and other things that are going into their system appropriately, it gives me a good idea as to the overall picture of what's going on for that person. So you really want to see what's going into that guy, or child or adult. So I do a hair analysis. I use Doctor's Data Lab, and I find really good results and quality reproducible information about their manganese levels and their iron, and like I said, the molybdenum and lithium and selenium, etc. on the bottom part. And on the top part of the page, it talks about aluminum and antimony and arsenic, cadmium, beryllium, bismuth, lead, mercury, uranium, nickel, silver, tin, titanium. So they give me a good idea as to what's going into the person. I use that as my exposure meter. I like to think about the body as like a bathtub of life. What's gone into the body for the entire lifetime of that person, what is your bathtub of life holding? And the faucet, what's going into your body for the last 6 months, is represented by the hair. So if you think about your hair exposure meter, what tells you what goes into the person for the last 6 months, that's your hair analysis. And what is in the body is when we do a chelation challenge, where they give them a magnet of some variety, and we see what comes out of their urine. That talks about body burden. So that's my way of determining what's going in. So a person says, hey, I got a lot of lead coming out of me in my urine challenge. Am I still getting some exposure? I say, well, let's do a hair analysis and find out what's going on. But my pediatrician, did a lead level on my son, and it was negative, so there was no lead in him, they said. And then I do a hair analysis. I say, you have a lot of lead going into your tissues. And I do a urine challenge with a chelating agent, and you have a lot of lead coming out of you, but you don't have it circulating in your bloodstream. It's trapped in your organs. So it's very difficult to get a parent to realize this when they're, quote-unquote, a specialist pediatrician who's known them all their life, who doesn't know anything about heavy metal detoxification, says you don't have any heavy metal burden in your child because the blood test was negative. I just find that very difficult to work with. But then when you explain to them why and you give them the reasons and make them understand this a little bit better, knowledge is power here. So when you explain things to people, they understand it. Then they say, hey, now I understand where this is coming from.
So now, once they figure out that there are heavy metals or there are, toxins in the body, how do we safely remove this burden in our system? And, and are there special supplements that can help us?
And GI changes, etc. So you always have to really fortify lots of probiotics. Before you start any chelation program, first of all, you need to balance the person. So this is not the first step to do. Plenty of other things that have to be done first. So hopefully when we got to the discussion of, hey, let's look for heavy metal burden, we've already taken care of balancing the nutrients that are needed by getting the person on a good diet, watched out for some of the food allergies, prepared their gut for good balancing. If you treat the gut, you treat the brain. A lot of you kids you can just get by with improving their intestinal tract and improving their diet, and they wake up and you get rid of some of their autistic symptoms dramatically. But when you repair all that and you've now balanced the human frame so that you can then go to the next level, they're doing well, they're pooping, they're peeing, they're having less problems, they're not having diarrhea, they're not having constipation, they're actually having daily bowel movements. Then you could entertain the possibility of let's go after some metals. Because if you have a kid who's constipated, who's pooping every 3 or 4 or 5 days, or you're not going to be able to chelate anything out of him because it's going to get stuck in the system. He's not going to evacuate. We evacuate stuff from our body by sweating, by peeing, and by pooping, and by breathing to a degree. But that's how we get rid of stuff. And if our systems are not working properly, we're not going to be able to unwind the negatives in our body. So just remember that first. You don't jump into a detox program until you've balanced everything else first. And then once you've gotten the person balanced and their yeast situation is under control, and it's a small kid who doesn't do well with an IV, then I'll put a magnet into them that will pull metals out, and my favorite one for oral stuff is DMSA. And then we'll give them DMSA at the appropriate dose based on their weight. And then what I will do is I'll give them a loading dose and measure their urine before a chelating agent and after a chelating agent, and see if the chelating agent really did a lot of work for us. And that will tell us, hey, this chelating agent works well. After a period of time, if that's the case, then we will put them on a program and then serially repeat it every 6 weeks or so and repeat the urine challenge. If the kid is old enough, or if they've exhausted the capabilities of DMSA alone by removing metals out of the system, then the next step that we will do safely is to give them calcium EDTA intravenously and follow that with a glutathione push, and that will really start to push metals out of the system. And again, we would do a before and after tests as well to see what do they pee on their own and what do they pee with a chelator. And if we find a huge yield of what comes out of the person, then we can measure that. We can serially measure that and have the kid come in for intravenous therapy once a week or even twice a week, depending how good their kidney function is and how good their veins are and how well they sit there. And usually they love it because they feel better, so they come back, and they don't mind having a needle in their arm if you have a good nurse in your office. And if you can get kids to start having more eye contact and speech and behavioral improvements, and that's the key to life. So that's what we shoot for. You just have to be careful that you are also pulling out good stuff as well as bad stuff. So you need to supply them with appropriate nutrients. You want to think about what else can we give kids if we don't want to do a chelation therapy. So cilantro is a good item. Anything that has a sulfhydryl group, sulfur with a hydrogen next to each other, like alpha-lipoic acid or cilantro or garlic. Those are good guys that work. Quercetin helps a little bit. Vitamin C is a little bit of a chelator. But those guys are baby steps in comparison to DMSA, EDTA, even D.M.P.S. But that's really potent D.M.P.S. I save that for adults only. I just find that just very difficult on the system because it is extremely strong. And you can do serial monitoring of your urine challenges to see how well you're pulling metals out of kids and see where things are. And that's what I do in my practice.
Well, I think that people are so lucky to have you understand all of that. I know parents are listening going, oh my goodness, I had no idea about this, or I had no idea about that. And even veterans in the community that, we've been around for quite some time, we learn every day. So I think this is just super valuable. I'm going to switch gears a little bit.
And if you really should also make sure the doc you see is someone who's certified. And there's, I went to ACAM, the American College for the Advancement of Medicine. I've been to the Integrative College, the International College of Integrative Medicine, and learned chelation therapy from the best of the best. And in order to be able to say that you're certified in chelation therapy, you need to take certifying exams. So when you're looking online, and again, acam.org is a really good spot to look at because that'll give you an idea of the doctors who've taken courses in chelation therapy and then hopefully passed the CCT exam. So you really want to see not just the guy went to the conference or the girl went to the conference, but the person took a certifying exam to prove that they have knowledge in this topic. If you go back to the days of Dan, Defeat Autism Now, with an exclamation point, there were a lot of doctors who listed themselves as Dan doctors. Well, that means they went to a Dan meeting. That didn't mean they knew anything except that they attended a meeting. So M.A.P.S, which is a Medical Academy of Pediatric Special Needs, formed after Dan was showing that, all these docs were claiming, I know this because I went to a Dan conference. Well, the reality of the world is if you're not trained properly, then you shouldn't be taking care of kids on the spectrum unless you really know what you're talking about. So the Medical Academy of Pediatric Special Needs, M.A.P.S, which meets twice a year, teaches physicians how to take care of autistic kids. And I'm proud to say I've been on the faculty of M.A.P.S for, 4 years since they started. And we give talks twice a year and training physicians around the world who come from so many different countries to come to these conferences and learn on how to take care of autistic children. And I'm happy to say I'm involved with that group quite a bit and training doctors, as well as with the Autism Education Summit that's happening every year in Dallas. That's a phenomenal conference for parents as well as for doctors, where again I'm on the faculty to try to teach the parents as well as physicians on how to take care of autistic children. And you really need to find a doctor who's well trained. So if you contact M.A.P.S or you contact yourself, I'm sure you have a huge volume of people through Generation Rescue or through your organization where you can steer parents into the area. And parent groups like talkanow.org are fantastic as well, because they teach parents as to who they can work with, what they need to look for in their medical physician who's supposed to be knowledgeable in autism.
Absolutely. Yeah, they can go to Autism Hope Alliance website, and we have a whole resource section there, and a lot of the places you talked about are all listed there. So if you guys want those resources, you can just go to autismhopealliance.org and go to resources, and every single one of the websites that he was talking about is there. I want to switch gears a little bit. I want to make sure we have enough time to talk about what we're here to talk about is hyperbaric oxygen, and I know a lot of people don't really know what that means, and sometimes they have this idea. I get this question a lot. Is that the thing Michael Jackson, slept in? And what is that? And why would I want to do that for my kids? So I guess the first question is, how does hyperbaric oxygen therapy even work? And really, what is it?
I have no idea. I don't even know why you asked me to do this. I'm kidding. I love hyperbarics. I've been a diving medicine doctor since 1992. David Perlmutter was one of my mentors back in 1994 at ACAM. And he taught me that you have to think outside the box and learn that there are ways to help people with therapies that are out there. And one of my favorite therapies, my favorite anti-inflammatory, is hyperbaric oxygen therapy. So hyperbaric oxygen therapy is basically looking at what is it going to do. That's your first question you have. It's a easy, safe, effective, 8-foot long by 3-foot wide soft cylinder that a parent and a kid can hop into. It's at air. It's going to be at room air around you. You're at 21% oxygen and 78% nitrogen currently that we're standing or sitting around surrounding us. Our red blood cell in our body that carries oxygen to our tissues, unless you're a smoker and unless you're having a big-time problem, you're probably carrying 98% of your oxygen carrying capacity in each red blood cell. So the red blood cell, if you ever go to the hospital, they put a little crimper on your finger and it measures your pulse ox, how much oxygen is in your red blood cell. It's probably about 98%. If I gave you nasal oxygen, then it might go up to 100%, so you can't carry any more oxygen. Remember also that in the blood vessel, you have red cells that carry oxygen, again at 98% probably, and you have liquid. This liquid is called plasma, and the plasma bathes around the red blood cell. And the plasma carries no oxygen or very little amount of oxygen. Most of the oxygen is tied up in the red blood cell, and that's very important because when we put hyperbaric conditions, increased pressure of oxygen into the person by having them lie into the zippered bag or harder chamber, oxygen bubbles are forced into the liquid component. The red blood cell, again, is saturated for 100%. You can't do more than 100%. But the liquid component around the red blood cells are going to have little dissolved bubbles of oxygen in the plasma. This is an area of liquid that can transmit areas that the big red blood cells can't get into. And this liquid medium, where the oxygen bubbles are now sitting, can cross the tissues, cross the blood-brain barrier much easier, cross into the joint space, cross into the synovial fluid, cross into all these different compartments much greater than the large red blood cells can. And this causes idling neurons, the nerves that are not firing well, to start firing. And that's how it works so dramatically in some of these autistic children. So hyperbaric oxygen, if the brain makes up 2% of the body weight, it uses 20% of the body's oxygen. So when you have small increases of oxygen pressure with hyperbaric, you markedly improve the oxygen delivery to the peripheral tissues as well as the mitochondria. That's always a big word for people to first understand is mitochondria. That's the energy supporting structure of each one of the cells. And you guys have been doing this for a while, know all about mitochondrial dysfunction associated with autism. And your mitochondria, if you're not feeding them oxygen well, and carnitine and CoQ10 and other cofactors and fatty acids, your body can't make energy well. So the idea is, let's see what can we do to help an autistic child. Well, if we look at how it benefits autism, in autism you have decreased cerebral perfusion. They've proven that with various studies. Well, hyperbaric oxygen causes increase in cerebral perfusion. In autism, we have increased oxidative stress, increased inflammation, and hyperbaric oxygen can decrease the oxidative stress around us and can also decrease the inflammation. There are certain inflammatory markers, they're called cytokines, such as TNF-alpha or NF-kappa B, and those items are markedly increased in autism, very inflammatory disease. And HBOT has hyperbaric oxygen, HBOT for short, can show to be decreasing these inflammatory cytokines. And HBOT actually also increases stem cell release for neurologic tissue repair. So these are the reasons why it's been very helpful. There are various ways of looking at it. There are tests called SPECT scans, SPECT scans, and there were studies that were done where it shows poor perfusion of oxygen to the brain and activity, more importantly than perfusion, poor activity in the brain before hyperbaric therapy and after 10 sessions of hyperbaric oxygen therapy at the soft chamber item, which is at 1.3 atmospheres, with no extra oxygen. The activity in the brain markedly increased by just putting a kid at pressure. And when you add oxygen to the chambers, then it even further stimulates oxygenation and tissue repair. And these are the reasons why it works.
Now, how would you ideally propose to schedule, let's say a child with autism for using hyperbaric oxygen therapy in either your office or in their home?
Well, there's many beneficial off-label indications that hyperbarics can use. We mentioned for autism, it works well in ADD, ADHD, PDD, Asperger's. It's been very helpful in my practice for Parkinson's disease and multiple sclerosis, Crohn's disease, Lyme disease, stroke patients, traumatic brain injuries, migraine headaches. Reduces fracture rate, and we've gotten kids out of the casts 40% of the time in cast, 40% faster than they would normally do it. We've had fibromyalgia patients and memory loss patients, and for the most part, they're all going to do a similar schedule. We want to try to get at least 4 or 5 days a week of hyperbarics per week into the kid. We want to try to have them go in for an hour to an hour and 15 minutes at pressure. And it takes about 7-8 minutes to go down pressure, and it takes about 7-8 minutes to come back up. If you do it slowly, if you need to get out in an emergency, you can get out in about 2 minutes. So it's really very easy. It's like if you go to the bottom of a 11-foot swimming pool. If you've ever done that before, you realize you have to get your ears to sort of equilibrate to the different depths. So that's the slowest point. That's what you have to really do slowly, is to try to get yourself down to that level. You're not moving anywhere. You're just lying in a plastic, cylinder with visibility through the various portals and little windows. And in my practice, we have a little call button in case you need there. People do walkie-talkies. In the soft chambers, you can bring in with you a DVD player or a CD or a computer, laptop, your iPhone. So the kids really, after the first time they jump in there, in my practice, we try to have people change into like white scrubs, so they're not bringing their dirty clothes in there. They're not taking their chemicals that are on their jeans and pushing it to their skin. So I give them white scrubs all the time to climb in there. And by the time the mom is getting ready to change into her white scrubs, the kid's already back in here. I want to go back into the spaceship, is what they thought to say. So it's really pretty cute to see how fast these kids respond after the first treatment or so. and they say, wow, I really start to they may not be able to even verbalize this stuff initially, but their speech pattern gets much better. And some of these other processes, eye contact, etc., have been shown to be improved. So it's really neat. Dan Rosenall, as well as Andrew Usman and Jim Newbrander, they all did a double-blind placebo-controlled study back in I think it was 2009 they did it. And the study showed that children who received hyperbaric oxygen therapy at 1.3 atmospheres for 40 sessions had significant improvements in overall functioning, receptive language and social interaction, and eye contact, sensory and cognitive awareness compared to children who received only slightly pressurized room air. So this is one of the landmark studies, and it's been proven a number of times as well, to show benefits from hyperbaric oxygen. You asked how would I schedule somebody. So again, I would have a kid either rent a chamber in their home, which these items are made for home use. And in that case, the kid can go in, let's say, in the morning before going to school, and then come back, go in for an hour, go to school, come back after school, 4 hours later from the first time they came out of the chamber, go back in again, and go in for another hour. And they can even then go out and do some homework, and before they go to bed, or they can go back in the chamber a third time. You can actually go 2 or 3 times a day in a chamber. If you have one in your home, it's a lot easier than coming to my office for that. But people do that. As long as you have a 4-hour break between chamber sessions and you're taking some antioxidants, then there should be absolutely no problem with hyperbaric therapy. I would definitely not recommend kids who have problems with sinus infections at the time to go in there because it's tougher to clear your ears. And the contraindications for the parents is they shouldn't have a chest tube within the last 6 months. They shouldn't have any emphysema, and they shouldn't have had a spontaneous lung collapse ever in their life. Those are the contraindications. So there's a lot of people who it's very safe for, because that's a very small group of the population that have negatives that will not allow them to go into the hyperbaric chamber safely.
Now, you mentioned supplements. What exactly, is there a particular protocol, special supplements that you need to give a child who's doing hyperbaric therapy, or is it unique for each case?
Well, it's not really unique for each case. Like I said, if you're going to go into a hyperbaric chamber, we're going to be exposed to an increased concentration of oxygen. So there are some reactive oxygen species that can develop from this higher pressure of oxygen. So how do we reduce reactive oxygen species? Is we take an antioxidant to help bind and enable extra reactive oxygen species. So coenzyme Q10, hopefully every child is taking. Melatonin is a phenomenal one to take. A lot of kids take carnitine, a lot of kids take vitamin C. These are all antioxidants that will help reduce any of the negatives associated with repeated uses of hyperbaric oxygen therapy. So any kind of antioxidant support, I mentioned 4 right there. Vitamin E is another good antioxidant. But I usually have my kids take melatonin or coenzyme Q10 or carnitine or all of them in low doses. They really don't need to be super high doses, but as long as you have a good antioxidant on board. When people go in hyperbaric chambers, I usually recommend they do that, both adults as well as kids.
Now, you recommend. You already talked about how many times a day you recommend a child to go in, and you kind of talked a little bit about bringing in their DVD players, and a parent could go in with them. For those people that maybe have only seen the hard chambers, can you bring in electronics in the hard chambers?
No, absolutely not. Those are usually done with 100% oxygen. So 100% oxygen increases the risk of fire, and you don't want to bring any kind of thing that could have a spark or a metal or an electronic discharge. So I only use hyperbaric. I have 4 hyperbaric chambers in my office in the soft variety, and we have a number for rent. And the ones in the office, we always want to make sure you can come in with, I have the soft chambers, the 1.3 atmospheres, and you can bring in any electronic device that you want.
And then you talked about rentals. I think that's important for people to know, because they might be listening going, well, how am I ever going to get a hyperbaric chamber at my house? And I think it's important to know that they do have rental programs, and the doctors that are doing this can kind of walk them through it, like yourself, correct?
Yeah, they really do. It's very easy. If I have someone in my community who needs a rental, then I have one of the guys who runs my hyperbaric department in my office will go to your house and set up a chamber in your house. It's really very easy to do. If you don't live next to a physician, who has that situation, then the company that I use is OxyHealth, OxyHealth, and they will actually send the chamber to your house and give you instructional videos of how to set it up. And I think it's just a shipping cost fee that's a little bit annoying, but it's really not that bad to have a chamber in your home delivered from OxyHealth. They're the company that makes the best quality ones. I wouldn't go with any other chamber company besides OxyHealth. They stand behind their product, and they really are great to work with. And a lot of parents will end up purchasing a hyperbaric chamber because they realize that this is a great therapy, and my child or myself, I'm going to have Crohn's disease all my life, and it knocked my flare-ups of my Crohn's disease or my arthritis or my multiple sclerosis or whatever, and I have an autistic nephew or grandchild, and we're going to see if we can help him out as well. So a lot of parents will, or a lot of adults will purchase hyperbarics for themselves, or parents with autistic children will get them for their kids. And I have a number of parents who have chambers in their home, and it's amazing to see how fast those kids excel and compared to some of the other kids who don't. You know, it's always a matter of where am I going to put my money? Am I putting my money into supplements? Am I putting my money into organic foods? Am I putting my money into chelation therapy? Am I putting my money into hyperbaric oxygen therapy? Can I do it all? Can I only do some of it? Well, the first thing you got to do is fix the gut. You got to fix the brain. You got to get the gut balanced, and that's the most important section you work with. And once that area has been balanced, then you want to think about how can I reduce inflammation. Well, I can reduce inflammation with hyperbaric oxygen therapy. I can reduce it with chelation therapy. I can reduce it with certain supplements and diet and plans in that regard. And what therapy is going to work for my kid? And if it didn't work the first time, then maybe you didn't finish unwinding some of the problems and then go back to it again. Always remember that food is medicine, and that what you're putting in your body is so important. You have to watch out for tick-borne diseases. You have to watch out for all these different things. And it's not just one thing you do, and it's not just the sequence that you do it in. If it didn't work the first time, don't give up. Go back to it later on once you've finished. But, you know, you want to think about what do we possibly do to help an autistic child? And there's no right answer. Everybody has their own way of doing it. This is what's worked for me in my practice. I've been taking care of autistic kids since 2005. I don't have any children on the spectrum. I don't have any friends who have children on the spectrum, at least when I started with this. So, you know, it's a love to try to help kids unwind the problems that they have. And that's why I got into this. But it's not like you have to do this and then this and then this and then this. There's no little puzzle that says we have to put this puzzle piece next to this puzzle piece next to this one. You got to figure out how to get your child balanced. So if you can do that with some of these therapies, and I've tried to outline some of the other people that, you know, the Autism Hope Alliance has shown for you, I think you as the audience will figure out what's the best thing for your child. But the one thing you must always find is the person who cares. If you can find a doctor who cares, who's been well trained, he's going to find the answer. You know, Jerry Carsonell is a wonderful doc. He's one of my mentors for many years, and Sid Baker and Nancy O'Hara and, you know, Dan Roswell. There's some great docs out there. And it's not always easy to see these people. But these are the people who care and who've really paved the way for us to follow in their footsteps on Jeff Bradstreet. And, you know, there's a lot of people out there that have been great to us. And Dr. Usman, you know, they're just wonderful mentors and caring physicians. And that's who you have to find, is someone similar to that, if not them, because they will definitely get you to the right pathway by figuring out one therapy, then the next therapy, then the next therapy, and consider hyperbarics and consider detoxification safely. And I think you'll really come to the right answer of finding how to turn your child around.
I think this has been such an informative call, and I think that the parents, I'm sure I was writing notes, and I know that they're probably writing notes super fast as well. I know they probably want to know how they can get in touch with you. So how can a parent who's listening right now get in touch with you, Dr. Dornfeld?
Well, my email is probably the easiest way. My name is Dr. Dave Dornfeld, Dr. Dave, Dornfeld, @gmail.com, Dr. Dave Dornfeld @gmail.com. My office is in Middletown, New Jersey, and that's probably the easiest way to get a hold of me. The phone number there is 732-671-3730. But I'm not really looking for lots of patients. I'm just trying to give some information out there to try to help the community in and of themselves. I just think it's so important
to look at I mentioned it like 4 times already. If you don't balance the human frame, you're not going to get anywhere. So all these things, from tick-borne diseases to environmental pollution to GMOs to pesticides and not putting neurotoxins on your skin and not eating the wrong foods, I think that's so important. And then how can you get rid of the bad stuff, oxygenate the tissues to repair, and then you win. So it's a whole program that just makes sense. I think medicine is logical. And if you don't think of medicine logically, and you just do it algorithmically, I should say, then I don't think you're going to win. And winning means I uncovered a lot of these different avenues, and it allows me to find a way to pursue quality health care for myself and for my kid. And the other thing I have to tell you before I'm getting cut off on time here is I went to the Autism Education Summit, and I was speaking, and there must have been 175 people in the audience. And I had a couple minutes before that people were able to sit down, because I had a couple minutes before the start, and just try to break the ice to get people warmed up. This was a Saturday. And I said to the parents, I said, just by a show of hands, how many is the first time you've been to an autism conference? And this was Saturday. The conference started on Wednesday, and there was over 100 people had their hands in the air. And I said, oh, my God, you've been here for 3 days. You've been hearing about glutathione, and I shouldn't have given this vaccine, and I shouldn't have given this medication, and I should be on this diet, and I should do this, and I should do that. And you got to be overwhelmed. The one thing you must always do is listen to what the lady says when you sit on an airplane. When you go on an airplane, they tell you, in case oxygen is needed, put your oxygen mask on first before you assist others. I'm telling all your parents out there, if you don't take care of yourself, you can't take care of your kid. So please put your oxygen mask on first before you assist your child. And in that case, then you can possibly figure out the right way that I can go down a pathway to get my child back to me again. And if you don't think about taking care of yourself, and you're only focusing, as most parents do, only focusing on your kids, you're not going to win. You got to take care of yourself first. So please take what I said about doing these things for your children, take them wholeheartedly about taking care of yourself too. Please do that.
What great advice. Thank you so much for taking the time. I know your schedule is just super crazy busy, and so I greatly, greatly appreciate you taking the time to help our families today.
Well, that's what we're here for. You have a very nice day. Thanks so much for doing this.
Thanks, Dr. Dornfeld.